like Price is Right. You're not going to get a big prize. You're not getting a Aruba vacation. I'm not asking you to come on down. Go ahead.
My name is Marty Durr, and I teach psychiatric nursing. I don't think universal health care, or whatever we wind up with, is going to take care of our mentally ill. Recently we've had a fire in New York by someone who was chucked out of the state hospital because we closed it down. We've closed psychiatric units. We've left seriously ill people without a home, without supervision, without guidance to take medications. Then when they behave in ways we consider abnormal, we call them crazies and want them out of our culture. How do you propose to address that?
Well, I think there are a number of different facets to the problem. Step number one is to change our culture to understand that mental health is just as serious and sometimes more serious than physical health. We make this false division, but if you've got deep depression or you've got schizophrenia, that's worse than a broken leg. But right now, we feel sympathy for somebody who's got the broken leg, and we don't always feel sympathy for somebody who's got chronic depression. That doesn't make sense. So we've got to change our mindset and approach. That has to be reflected in our insurance system, because generally speaking, physical ailments right now are covered under insurance. Oftentimes, mental health services aren't covered at all. And that means there's underdiagnosis and a lack of treatment. So I am a supporter of the idea of mental health parity, where insurance companies have to provide basic coverage for basic health care needs, mental health care needs. We then have to also recognize that along the lines that I talked about of prevention, that mental health prevention, well, I didn't say that right, preventing problems in mental health is often an important way to prevent other issues down the road. And a lot of times when we consider, for example, criminal justice problems, are, especially among juveniles, they have to do with nobody ever diagnosed that juvenile's mental health problems, and if they were simply given some treatment, they would be sitting still in school, they would be listening to the teacher, they could pay attention. Instead, we end up having in jail and pay a lot more than if we had diagnosed them early. So our social services, both at the federal, state, and local levels, have to take that into account. I was talking to a police officer in Iowa who was pointing out that one of the reasons they've got problems with crime is that they have to respond to so many calls of homeless people on the streets that they can't deal with basic policing, and solving crimes, because they've got to pick people up and take them and just have them sometimes in jail because there's no place to take them. It's consuming a lot of criminal justice resources that could be devoted to reducing the crime rate. So one last point I want to make on this, because I think it really points to how we haven't understood mental health issues as much as we should, is dealing with veterans. The veteran population is 7 times more likely to be homeless than non-vets. Well, why is that? It's because we have so much undiagnosed post-traumatic stress disorder that when veterans come home, if they're not getting mental health screening and then getting treatment, oftentimes they will end up self-medicating. And that then gets them further into trouble. So I've already proposed that we've got to make sure that we have screening for every veteran who's discharged, that they immediately get treatment that they need. And that shouldn't be optional. The reason we don't do it is because there's still a stigma around it, or there's a sense that it's not real. It's very real, and it's something that I will prioritize when I'm president of the